Hi, it's me on a couch. I'm not in a car and I'm not holding the phone. I actually have a tripod. Yay. Well, let's see where I am. I got my blood tested today, and the last time I had it tested was 2 weeks ago. It's Monday. And 2 weeks ago, let's see, 2 weeks ago I was around 200. 220 or 200? I think it was 200. And the normal range for the platelets is 150 to 450. So 200 was good. Prior to that, it was 3 something because of the steroids. So 200 is definitely a drop, but it's still within the range. And okay, so now I've had 2 weeks of not having any intervention. I got some papaya leaf extract. I got some chlorophyll. Apparently chlorophyll is they say it's like the blood to plants, and basically it's a blood problem that I'm having. So I don't, it didn't do anything for me. But the thing is, it's also only been 2 weeks, so it could be something that takes more time. I don't know. I'm going to go to the store and get the 3 Ps, which are papaya, pumpkin, and pomegranate, and hope that that does something for me, and also wheatgrass. So my blood, did I say? No. See, I can't even really think straight. My platelets are 68, and I think that there's a little variance in that. So, that's lower than 150. And I'm going to get tested again in a week. My oncologist told me about 2 drugs. I had it written down somewhere that I could possibly take. And of course, every time you take a drug, there's like all the side effects that come with that. So I'm not really too keen on that. He's also, although I am going to look them up and just see what they say, he also is not a big fan of doing Ivigg, which is the stuff that is good for immunoglobulin. It's somebody else's blood, or some piece of somebody else's blood, and he thinks that it's very risky to do that regularly, so he doesn't really want me doing that. Unless I were to drop really low and become a high risk, then I would get a transfusion, most likely to bring me back up. So it's kind of odd, because he said that he doesn't see how there could be a correlation between chemo, radiation, and then me having this platelet problem now. But when I look it up online, it shows that it's something that can come from chemo and radiation. So I don't really understand how he doesn't see a link, because the internet sees a link. So he said that this can be chronic. It can clear up on its own. Basically, I mean, those are both possibilities, I guess, and anything in between. I might have this forever, or it might clear up on its own. I'm hoping that it's going to clear up on its own. Of course, that's what I'd rather. So I just don't know if I'm going to have to take something for that to happen. But basically, the main side effect, or the main symptom that I'm dealing with, is tiredness. I mean, it is 100 degrees where I live right now, or close to it. And it's hot, and we don't have AC in our house right now because it's getting fixed. So I obviously, I could feel really tired and fatigued just from the weather alone. So we'll see, once I feel cooled off, if I feel like I have energy. But some people live with it, this ITP, for their life. And I just need to be on the lookout for bloody noses or bleeding in the gums or anything like that. That's not happening. I'm mostly just tired. I also I don't remember what the word is that starts with a P, but they're these kind of little dots. I don't have that, so that's a good sign. I guess if it's dropped, my platelets have dropped by next Monday when they test again. I'm not sure. I don't know what he'll want to do. Just do a transfusion, because I would guess that they could go below 50. But he said some people live with really low platelets for a really long time because they don't want to take the drugs, which I don't blame them. I'm also getting a test for both hepatitis, or B and C, I think it is, and also something pylori, whatever that is. I don't know, there's some sort of connection. I think the pylori, the H. pylori thing, is a gut bacteria. I don't know anything about this stuff. Very little about it. So yeah, I'll get that test next week. I also am going to Stanford to meet with their hematology department, so that'll be interesting. It's really nice having my Grass Valley doctor and then Stanford, because I feel like I can at least get 2 sets of data of information and suggestions, recommendations, so I can figure out, what I want to do, and I've got 2 different things to take into account, as well as my own research and stuff. So we'll see what their hematology team says. I'm pretty sure they had ruled out leukemia before and any kind of bone marrow cancer. That's scary stuff. And then I also went to the cardiologist, and they did an EKG, and it looked essentially normal. There was something that he pointed to that could show up in a lot of people, and I can't even really wrap my brain around it. But if we were just to take that test, then there wouldn't be a problem. But I've come to realize that it's really not in my heart. It's really, I think it might be the muscle, it might be the tissue expander, because it's not beneath my ribs as far as I can tell. But I feel this pressure, and I've really felt a pressure in this area even before the tissue expanders. So what do I don't know. It's just a process of elimination. So they're going to put me on a treadmill and do whatever test they do when people do treadmills. And then they're going to do, I'm going to wear an event monitor and see if there's any abnormal heart activity. So those things are upcoming in the next week or 2. We'll see what comes of those. And then, I can't remember, I guess I left the video 2 weeks ago. So I was at Stanford and spoke to my main plastic surgeon who was gone getting married, and now he's back. And it was actually really sweet. He came in and he's like, how are you? You've been through so much. And I said, I'm doing pretty good. I mean, I have my down days for sure, but overall I feel like my spirits are basically up. A lot of times I have energy. I'm starting to build this business, and I feel like my spirit's intact. I think that's really a big piece of going through all this treatment is what is the health of one's spirit? There's the body, mind, spirit, whatever else there could be, the emotional self, the mental self. There are a lot of components to who we are. I think we're complex beings, and I feel like I remember after the first chemo, because I got this horrible reaction to the steroid where I was covered in acne, what looked like an acne, kind of cystic acne thing. And I looked at myself, and that's when I started to notice that I looked different. I started to look like a classic cancer patient, and I looked in my eyes, and my eyes looked dull in a way. They didn't have the sparkle that I was used to seeing, and my spirit was zapped. I felt like my spirit had really taken a hit, and I didn't know if I was going to recover. I was like, oh man, maybe this is it, And then I started to feel like I got my spirit back. So even though I don't feel like I'm the same person, I don't look like the same person, my spirit's intact. And to me, that's the most important thing of all of it. I mean, I do want my mind back. My mind is not where it used to be. It's hard for me to remember certain things. It's hard for me to track things the way I used to. It's hard for me sometimes to make connections in a way that I used to. But having my spirit intact is like proof that I'm alive, I know that sounds weird. I mean, just having a body functioning in the world is not necessarily an indicator of being alive or someone's aliveness, I think a person's aliveness really is their spirit. The spirit is like how much creativity we have, how inspired we are, how much will we have of our own, our faith. I mean, there's so much to me that's tied up in spirit. So anyway, all that to say, he came in and wanted to know how I was, because he said that is the thing that he sees women deal with who've gone through a lot of complications, which I have. I did ask them if I was the worst. I think I said this in my last video, and he said, no, you aren't the worst. There have been people who've had more complications than you, believe it or not. And I was like, okay, well, good to know, I guess. I feel for whoever those people are. But, so Spirit, and then his assistant, who I also love, or she's not really assistant but counterpart, she came in and she's like, how are you, dear? And I was like, I'm doing good, thank you. So they were just concerned about my emotional state of being, and I really appreciated that. So right now I have a tissue expander in. This is like, you rarely get to see my body because I'm usually in a car. I have a tissue expander on this side, and I currently have, this is a, I guess it's like a pillow. A friend gave it to me, who's also someone who's going through breast cancer, and she doesn't use it. She had a prosthesis, like the silicone stuff that they do, and I don't know what all the stuff is made out of, but I want to get one of the silicone ones because this one is basically like a pillow. It's like a pillow that you sleep on. I mean, it gives me a form, and it basically matches this side, and that's kind of what I want, is just the uniformity. Even though, you know, if you like really start to look, you can see there's no, you know, it's just flat and then this thing, but I'm so grateful for this. I really am. I mean, when I'm at home, actually, usually I just have, you know, I take it out just because I don't really need it in. But it's not a very comfortable feeling to like navigate through the world with this like full size breast and then not completely flat on this side. So I'm really grateful for this. But basically what the current plan is that I'm going to go in probably in December, and they'll put an expander in on this side because right now there's just the skin. They cut a lot of the skin away because a lot of the skin was damaged, you know, was ruined from the way the expander was pressing on it and like broke through, you know, my skin opened. So they had to cut a lot of this like damaged skin. The skin was like purple and dark and just ugh. So basically there's like a big incision. There's the incision under, because I got the inframammary incision when they did the mastectomy because I did nipple sparing. So I have the incision under, and then I now have an incision going, I guess it's below the nipple again. So I don't care about incisions. I mean, I told him, like, you can incision me all over the place, you know, like, I mean, just do what needs to happen, because, you know, they're like not quite talking me out of it, but telling me one of the major downsides to getting deep is you end up with, like, you can't see too much in the video, but you end up with this major scar, you know, from side to side, hip to hip, and it's like, I don't really care about that, you know, that's to me not that big of a deal. And but anyway, so they'll put the expander in, and right now my job is to put oil or lotion. I use oil, I use coconut oil, and just massage that skin because it basically like pulls in, and it's really weird actually. It does. It's like, I don't know why this happens, I don't know what it is, but it's like retracting in and tightening up, so I need to like put the oil on and massage it to try to like loosen it up so that when they put the expander in, there's something to expand. So I don't really know how that's going to go. I'm hoping that they can put in the smallest possible expander that they can do, and then I'll have that in for 3 months, and then by this time it'll be like next spring, 2020, wow. And then at that point I'll either have implants or have deep, or I did ask about having one implant and one deep, and he's just like, no, don't do that. I think I said that last time too. I'm just remembering. It's been like 2-3 weeks since I left a video, so I can't remember. I mean, I can't even remember what I ate earlier, you know. That's kind of what my memory is like these days. But yeah, so I'm giving myself a really long break, and though I'm living with like one breast and even one flat side, though I'm living with one breast, sometimes just the words don't really come out easily. I really needed the break. I mean, I think I've had 4 surgeries in 7 months or something. Is that right? I don't know. I don't want to figure it out, but I figured it out before. But it's something like that. And that's a lot. And 3 of those were emergency surgeries. No, wait, all 4 of them were. All 4 of them were emergency surgeries. I mean, that's insane. And then I'm dealing with this ITP now, so the immunothrombocytopenia, which my oncologist here thinks it's from the infection, because I had an infection, not MRSA, but MRSA, it's MRSA, methicillin resistant, whatever it is. So I guess MRSA is really bad, and people die of sepsis and all this stuff, or it's possible that can happen. And I didn't have MRSA, but I had MRSA, so instead of A, it was E. And then I just, being in the hospital setting and dealing with this infection stuff, my oncologist thinks that that's why I have the ITP. But I mean, like I said, I read online that it could definitely be from the chemo and radiation. So I'm not really, I don't feel like resolved or content with him telling me that it's not the chemo and radiation. I mean, he is the dispenser of chemo and radiation, so maybe he feels protective. I don't really know. But I want to understand that one a little bit more. So basically, I just need to, take rest. And that's really hard for me. I mean, I am laying down, which is good, but I'm supposed to just rest throughout the day, and I'm doing my best. It's really difficult for me to stop. I'm just kind of a go person. But I am trying to do my best. I went to yoga today, and I'm trying to get back into yoga, and I don't really know how good me going to hot yoga is, but it's just the thing that I enjoy. It's the thing that I've always loved, and I'm going to try not to do it too much, 3 times a week, and maybe 4, and we'll see how it goes. Hopefully, I don't know, hopefully it's okay. So yeah, that's where I'm at. My hematology appointment at Stanford's upcoming, and we'll check where my blood is next week, and yeah, I'm getting through it. I wanted to say one more thing, if anyone is still listening to this. I think I need to do another video on this at some point, but basically, if you haven't gotten a mastectomy, one thing I wish I would have asked and I would have known is, okay, so this was the side that had cancer, this side did not, but I had a prophylactic. I elected to have this breast removed for various reasons, and what I wish I would have known and what I wish I would have said, they thinned out, they scooped out so much tissue that the skin that is left is paper thin, and that's why I had the problem with the expander on this side, and the reason why it broke through is because of this thin skin, which I'm kind of how do they not account for that? I don't really know. But what I would have said is okay, there's no cancer on this side, there's cancer on this side. If I had the option for them not to thin this out so dramatically, I would have said that. If you're going to get it down to 1/8 of an inch, can you please spare me and get it down to half an inch so that I don't have to deal with this thin skin thing? Because the thin skin created major problems for me. And that's on the non-cancer side. So I feel very annoyed by that. But, I don't know why they did that until I know. I give them the benefit of doubt. I mean, it's Stanford, They aren't gods, but they know a lot, and they've done a lot. And until I resolve for myself, why did they have to thin the skin so far on the non-cancer side? I don't feel resolved about it, but I would tell any woman that is going to get a mastectomy, a bilateral mastectomy, on a non-cancerous side, I would say, please ask them if you have the option, because who wants thin skin, I mean, why give yourself other problems? I just don't understand why they would have done that. And I definitely would have asked them not to do it if I had the option. So I feel I want women to know that. So yeah, I'm feeling pretty good about stuff. I mean, October is my diagnosis month, and it's currently July, so I'm starting to approach the 2-year mark. And when all is said and done, I'm going to be 2.5 years from diagnosis. And I wish I would have known that this whole process would take approximately 2 years. I mean, it took me 2.5 years because I did a half an hour, I wish, half a year of alternative treatments solely because I was trying to heal this thing and get rid of this cancer the alternative and natural way, and it just didn't work for me, being triple positive and who knows why else. But I do think having HER2, you just, you can't F around, you gotta hit it hard. And I waited for 6 months, so who knows if things got worse or what happened. I think I just stalled. I don't think things got worse, but they sure didn't get any better. But so anyway, it takes 2 solid years. If you are watching this thing 19 minutes and a half later, which is so long, but don't think that you're really just going to breeze through this, because man, I thought that I would. I'm going to breeze through this thing. There's no breezing through, at least for me. I guess some people do one and done. You could go do direct to implant, get it done, but I've learned from talking to the doctors that it's very rare that happens. So I think you could really set yourself up for failure if you think that you're just going to get through this really easily. So I'll be done, I guess, at 2.5 years, and hopefully I'll be done and can like wipe my hands of this whole thing and really put it behind me. I'm so glad I'm through chemo and radiation, although I kind of regret doing radiation. That's another video too. I mean, I don't know. There's a lot more to say about that. But anyway, the point is to say, like, I'm really happy that I'm almost 2 years out, and I do feel like I'm through the hardest part. And now getting through surgeries is much easier than going through chemo and radiation. Those were really hard, really, really hard things. Surgery's no walk in the park, but it's doable, especially if you know what to expect. So yeah, thanks for being there with me. Thanks for listening. And if you have any questions or anything you want to say, please do, because I do like interacting with people. I don't always get to it, especially now with just being tired, but I do really try, and I read everything that anybody writes. So yeah, thanks. Take care.